So we've seen a lot of news coverage about what's going on, worldwide with this. We've seen medical experts on TV. We've seen people purport to be medical experts who are not, who are giving advice. I'm interested in hearing from each one of you, what are some aspects that are not often considered as people consume news and information from around the world on a variety of platforms, social media, traditional media, whether it's nutritional needs, mental health, workout, medications. What are some things that you'd all like to shine a light on that we should maybe be a little more thoughtful of? Maybe Caroline, have you start off.
Thank you. I think that's a great question, Kurt. And I have been, I guess not shocked, but disappointed in the amount of fraud and quackery information, just tons of misinformation that's out there, particularly just when I go through Twitter and see what's going on in the world a little bit, other social media platforms, and so many people out there promoting products, selling products that claim to prevent or cure coronavirus. And all of it is total bunk. And it's scary that people would buy into this, and when there's so much potential harm, particularly in the nutritional realm. Dietary supplements are one area where we're going to see a lot of quackery and misinformation. And I cannot stress enough that, number one, we need to listen to the experts and follow the CDC guidelines around social distancing, staying home, washing our hands. And if you have symptoms, calling your athletic trainer, calling your doctor before you go in anywhere. That's been made perfectly clear. There are no nutritional supplements that can boost immunity. I can't stress this enough. There's lots of habits that can support a strong immune system around hydration and sleep and stress management, but there's no supplement that's going to prevent or cure this virus. So if athletes are confronted with looking at some of these products, considering some of these products, I cannot urge them enough to reach out to us, to the team sports dietitian, to have a discussion, to get some education, to review the product, just because of the potential harm to their health, mentally and physically. And still, so many products, of course, are not third-party tested for banned substances. So, when everyone gets back together again and these products are in their system, they potentially could also test positive for a banned substance. So I want to help keep people healthy and keep people safe, and we have to stick to the guidelines.
I think one of the things that I've noticed that I feel like is a real issue for our students is this significant shift in structure and routine. A standard athlete, right, has fueling, training, class, fueling, training, homework, fueling. So it's like this standard routine, and it's been such a significant shift that classes are now online. Some of them are synchronous, some of them are asynchronous. Athletic training, workouts, as Caroline just talked about, nutrition, and team bonding, those things were all very team oriented and structured, and now they're all independent. So being able to find how to create new structure, how to establish a routine independently, something that works, that will be successful to help these student athletes, is a real issue. And so we are doing our best to support them, like Darryl said, from a 360-degree view. And the hope is that we'll see some success from that. The other thing I think that I've noticed quite often is we have a large number of international athletes. And so this whole concept of being able to come and go has shifted dramatically for them, especially with the travel restrictions that have been put in place. So our international athletes that reside in the UK, if they go back to the UK, can they return back to America with ease? And a lot of the unknown, we're supporting them through this and helping them make decisions that they feel comfortable with, that their families feel comfortable with, so that we can move forward.
I would
Darryl,
say,
any thoughts?
I would say the biggest thing is just, everybody needs to take this seriously, and listen to the advice of social distancing and stay at home orders, etc. The sooner we do all of that as a collective group in this country, the less time all of this is going to take. The longer that we ignore this, all of the advice and policies about stay at home, don't go out, then the longer that this whole thing is going to last into the summer.
Yeah, Darryl, maybe on that, can you explain it like I'm 7 years old? The idea of flatten the curve and why that's important from a health perspective and a medical perspective.
I'm probably not the best to explain this. The best thing that I've seen, there are a couple things. There's a Washington Post article out there that really details what the spread of disease with a bunch of ping pong balls. The best thing I've seen for explaining to kids is if you just take like a dish of water and dump some pepper in it and watch how some pepper clings to others and others scatter away. That's probably the best way I've seen explained for little kids. This is a respiratory illness. They haven't shown great success of it living on surfaces for a long time. So the way that you're gonna get this is if you're in close contact with others. And I think everybody needs to understand, and this has been hammered home to us at our EOC meetings, is this is in the community now. It's probably been in the community for a long time, but 100% this is in the community. This isn't somebody that traveled to China and brought it back. This is in the community, and pretty much everybody has been exposed to this now in somehow, some way. And the more that you're around other people, the more that you're around somebody who's an asymptomatic carrier of it. It's not shown a lot to greatly affect young, healthy individuals. So being on a college campus, chances are you've been around 200 or 300 people that are carrying this and infecting others. But they're young, healthy individuals, so they aren't showing signs, symptoms. The incubation period's been shown to be about 5 to 6 days. So, people aren't getting sick until about 5 to 6 days after they've been exposed to it. So during that time, they're exposing other people, which is the whole flatten the curve and the social distancing to keep everybody away so you aren't exposing others. And so those are all the things that we know, but it's just a matter of, and what we've preached to the athletes is you've been exposed to it already. We need you to self-monitor. We need you to let us know as soon as possible if there's symptoms, but we also need you to isolate and self-isolate and stay in your house and don't go out and don't have big parties, etc.
Yeah, I think that's all really helpful. One of the things that struck me was almost certainly at other schools, but certainly at the University of Michigan in the first few days that this really became public, we would get notifications if somebody at the University of Michigan tested positive, and they would basically draw back a timeline of where that person had been and who might have come into contact with them. And that all ceased several days ago, where they basically said, this is now called community spread, and we're not able to tie it back necessarily to a specific interaction with somebody else who was known to have been here, or here. And they basically said, we're going to stop providing those kind of updates. It's community spread. It's everywhere. Assume that you've been exposed to it. And you kind of have these moments where it hits you and you're like, oh yeah, it's no longer, oh, I wasn't at that building, so I'm okay. This is all over the place. So in a way, though, I found those updates to be very helpful for me in helping to understand the size of this. So.
Yeah, Kurt, when I think of flattening the curve, also to add to Darryl's comments, I think of slowing down the spread so that we don't overwhelm the healthcare system. And, you know, thank you to all of the healthcare workers who are going in and working tirelessly to do the testing and take care of patients. All of the people who are working in restaurants and grocery stores and really keeping our communities going. I can't thank all of these people enough. It's just such a huge effort, and for these sectors of the community that sometimes are underappreciated, I think that a huge amount of perspective has been gained when you know your grocery store is open and your pharmacy is open and your doctor is available.
Yeah, Kurt, I mean, that's with flattening the curve, that's the big thing from a healthcare perspective is there are only so many respirators in this country. And so the more people that bombard the healthcare system, it's just going to make it that much worse because we don't have the respiratory isolation rooms. We don't have the respirators. We don't have the clinical staff to take care of everybody if the health system gets overloaded. And we got to be concerned about the healthcare workers, A, getting burnt out, B, having family members at home that need them, or their support network at home that need them, and C, them getting sick themselves because they're exposed to it every day, all day. So that's, you know, that's the part of staying in and flattening the curve that often gets overlooked is just the whole healthcare system. Once that starts getting overwhelmed, then they have to start making hard decisions of who gets a respirator. And that's something that no healthcare worker wants to make that decision of, well, I have to choose between basically letting somebody die because you aren't providing a respirator because you only have, you know, one respirator and there are 3 people that need it. So that's the big thing with the healthcare system.
You know, on top of the reality of everybody else in our society who needs a hospital for other reasons, other health issues, not just COVID-19. So yeah, it's staggering when you think about what the numbers could become.